One of the most common questions that I get is, Alex, even though I have to switch my insurance plan, how can I keep my doctors? I really love my doctor and I don't want to switch. We're going to talk about that today. So one of the biggest promises of the Affordable Care Act was that you'd be able to keep your doctor. That's a big concern for people. They build a relationship with their doctor, they like their pediatrician, they've been with the kids since they were born, they don't want to switch. Well, on the Affordable Care Act in the marketplace, it hasn't quite worked out that way for most people. That's because the insurance companies have had to limit the networks. And so when they limit the networks, less doctors are in network for those types of plans. So is there a way around this? And do we live in a day and age where it's possible to keep your doctor? And the answer to that is yes. All you have to do is have access to a PPO network. Preferred Provider Organization is what PPO stands for. And that is going to give you access to more doctors and hospitals. If you have a PPO, most likely you can keep your doctor. And so here are some of the benefits of having a PPO. Number one is access. And I know I sound like a broken record when I say this, but access to the best doctors and hospitals is one of the biggest benefits of having access to a PPO plan, a Preferred Provider Organization plan. And so why is that important? Not only do you get to keep your doctor that you've been using, even if you're healthy, your pediatrician or your primary care physician, but what if, God forbid, something happened to you and you come down with some crazy diagnosis that you want to go to the best specialist in that area, and especially if it's your child, if it's something that's very rare, a rare condition that you get a diagnosis and you want to go to the best. You don't just want to go to anybody that's on a short list of, some downloadable list on some website that they give you. You want to choose. So this is one of the biggest benefits of having access to a PPO network. Number two is being able to book directly with a specialist. So why is that important? So with a lot of HMO, health maintenance organization, and EPO type of plans, like a lot of the marketplace plans, you have to get a referral from a primary care physician in order to go to a specialist. You can't just book an appointment, for example, with an orthopedic specialist if you haven't already seen a primary care physician and they've given you a referral. So why is that annoying if you had to do that? Number one, you're gonna have to pay 2 copays. You're gonna have to pay the primary care physician and you're gonna have to pay the specialist when you finally go and see them. And those copays can be pretty expensive. And also, you don't wanna have unneeded delays in trying to get directly to the specialist, because you know that that's the person that's really going to be able to help you. You want to go directly there and save time and not have to get the referral first. And number 3 is being able to have access to doctors and hospitals, not only that you want in your area, but also nationwide. So why is that important? So if you're a frequent traveler like I am, I want to make sure that if I'm in Tennessee or that I'm visiting California, that I'm going to be okay if something happens to me, that I can go to see a specialist directly, that I have the same coverage anywhere I go in the United States. So that's what a PPO will give you. And most PPO, especially if they're bigger networks, they'll give you that nationwide coverage. Also, why this is important is, let's say that you move. A lot of people are moving to other states now. Businesses are more virtual than ever. And so you see people moving from Florida to Texas, from California to Texas to Florida, and all over the place. And so on the marketplace, you've got to switch insurance plans every single time that you move, because a lot of the plans really cover you just, in that geographical area, and then you have to switch. And there's a bunch of reasons why that's annoying to have to do. Not only will you have to incur more costs on your deductibles and whatnot, but you have to switch what you're used to and with your insurance plan. So to avoid this, if you're able to get plans that have a PPO network and it's a nationwide network, you're good. You don't have to switch insurance plans every time you move. So I know what you're thinking. You're thinking it's going to be super expensive and outside of my price range, right? I have all this access, and am I really going to be able to afford something like this? Well, there are alternatives to the marketplace coverage that doesn't give you that. There are alternative options, there are underwritten private options. And so if you're someone like me, 5 years ago, where I was really looking to get insurance that I could actually afford, and I was healthy and I didn't need to go to the doctor 10 times a year. I just want to go get my regular checkup, want to make sure I'm covered in the event that I have a sports injury or something happens to me. I just want to make sure I don't have to file for bankruptcy if I ever have a health scare. then, and if you fall in that category, you may qualify for underwritten private coverage. And one of the biggest benefits of it is that not only do you get to keep your doctor and you get an amazing PPO network, but it's also usually more affordable than what you would get on the marketplace, and usually a lot more affordable. So if you have questions about this and think, wonder if maybe you'll qualify for this or it's something that you should look into, please don't hesitate to reach out to me at alexandracontos.com. And if you found this video helpful or you know somebody that could benefit from watching it, please tag them and go ahead and share it and comment and like.